Oh, I think we're live now. Are we live?
Yeah, we're live.
Okay. Hi, everyone. Hi. Welcome back. I'm Dr. Teresa Sclafani, Dr. S, and this is
Noodles or Tiffany's or whatever.
Okay, Noodle. Welcome to Live with Dr. S. Less is more. We're talking all minimally invasive medicine and beauty from your interventional and vascular care. Here in beautiful Garden City, Long Island, New York. I am the physician here, obviously, and the founder of Your Interventional Vascular Care. I'm a board-certified interventional radiologist. And today, do you know what we're going to talk about today, Noodle?
No, what are we talking about?
You picked the topic last time.
We're talking about UFEs.
Yes.
Uterine fibroids.
We are talking fibroids, ladies, everything fibroids. And then at the end, we're also going to talk about, it is June, which is National Acne Awareness Month. So we're going to talk about some treatments that I have for acne.
Okay.
And, again, our medical grade skincare products, stuff that we can do after the treatments to help, with your skin. All right. So we're going to talk uterine fibroids. We're going to talk what uterine fibroid embolization is, that versus hysterectomy and why it's better than hysterectomy. And then we're going to talk Morpheus 8, which is microneedling, radiofrequency microneedling. And we're going to talk Opus, and those are for active acne and for acne scarring. And we'll talk about some of the skincare at the end. So come on in, everyone. Ask me questions in the chat. Do I need to do anything with the chat?
No.
Tell me how many of you out there have uterine fibroids and how many of you went to a GYN doctor and was told that hysterectomy was your only choice. Because that is not true. Hysterectomy is not your only choice. And we're going to talk about clinically proven, FDA approved, minimally invasive procedure that will take care of your uterine fibroids without surgery. Same day procedure in the office. Takes me a couple hours to do.
Okay.
And then you go home and you recover. It takes about 5 to 10 days to recover, and that's it.
And then we can all go dancing.
We can all go dancing. Hey, I had a patient who was running on the treadmill training for a marathon at day 5. I told her, I was like, you gotta stop. He's like, give yourself a beat. And she's like, I feel great, Versus, hysterectomy, which takes, 8 weeks. So, all right, let's start with everybody, I encourage you to comment and ask questions. All right, let's start with uterine fibroids. Noodle, do you know what a uterine fibroid is?
Fibroids in the uterine.
She's such a smart ass. Okay.
That's it in the name.
Yeah, okay, all right, we'll elaborate on that. So, uterine fibroids. Uterine fibroids they're benign, non-cancerous tumors. Anything that's a growth in our body, we call a tumor. I know that people hear tumor and then they think cancer, which is, frightening. But no, it's not cancerous. They're completely benign. They don't turn into cancer. They are extremely rare, but it's extremely, extremely, extremely rare. So anyway, they affects up to 70% of women by the age of 50 will have uterine fibroids. Usually it's premenopausal women. After menopause, the fibroids may shrink because of hormones, actually. They help the fibroids to grow. They encourage the fibroids to grow. Okay. So, some women after menopause, the fibroids will shrink because there's no longer hormones. But, if you don't hit menopause until your mid or late 50s, your fibroids are killing you until then. So basically,
yeah.
I don't mean, I guess they could. They cause anemia. So
we're thinking out there.
Yeah, I'm getting off track. But just because that many women are affected with fibroids, it doesn't mean that they're normal or it's something that you have to live with. As women, we're kind of conditioned to live with pain, right? Because every month, we get our menstrual periods and we get cramps and we get bloating and we get pain. And then we kind of think that's normal.
Yeah.
Right.
We do.
So, and if you've been dealing with fibroids for many, many years, you may think that is normal. That's your normal menstrual period. But it's not. So, and you don't have to live with it. So, what are some common symptoms of uterine fibroids?
Okay. Strong period pains. Extreme bleeding.
Mm-hmm.
Don't know anything.
I mean, those are the biggies.
Okay.
So,
Tell the difference though.
between what?
Like
Normal
period,
like I just
pain.
have bad cramps. So, women who have uterine fibroids, a very common symptom is extremely heavy periods, extremely heavy. And frequently, almost all of the women will come in to me and say, when I have my period, it looks like a murder scene. That's how bad the bleeding is. A lot of women will present with anemia, which, if you don't know what anemia is when your blood level is like super low. So, and women, naturally, our blood level is lower than men because men don't bleed every month. But because we bleed every month with our, menstrual periods, our blood levels will be a little bit lower than men. But, a normal hemoglobin is like, 11 or 12. That's a normal level. Women will come in with anemia. I had a patient present to me, her fibroids are so terrible. Her hemoglobin was 6. Like, that's half normal. And that's not okay. I mean, if you're young and you're healthy, your body will compensate. And so you can get by with a hemoglobin of 6, but you'll be really tired and run down and just feel awful. And it is dangerous. It is dangerous, especially like an older patient. A hemoglobin of 6 is dangerous. If you're in the hospital and you have a hemoglobin of 6, you're getting a blood transfusion. Like, that is just, that's how it goes. So, yes. So, it's not just a bad period. It's like a horrible period. Like, a lot of times women will say, I have to change my tampon every hour, or I have to change my pad every hour, or I can't make it through the night sleeping without having to get up multiple times and change my pad or change my tampon. That's how bad the bleeding is. So, and cramps, terrible cramps that get worse when your period comes, but a lot of times women will feel bloating and pressure in their pelvis or their abdomen all the time because the fibroids, when your period comes and you have the spike of the hormones, they will get worse and they'll feel worse, but they're there all the time. So if you have very large fibroids or a large number of fibroids in your uterus, you're going to feel that bloating and that pain and that pressure in your pelvis all the time. Some women, the fibroids will grow so big, they'll look like they're 3 months pregnant. Yeah.
Oh.
So they'll get bulging of your abdomen. Mm-hmm.
Wow.
So if you have like a firmness in your abdomen and you don't know why, it could be from fibroids. They can also cause infertility. So fibroids grow. So the muscular wall, our uterus is basically a big muscle, and that's how it expands. And then when it's time to give birth to the baby, it contracts, and that's how the baby gets out. So the fibroids can grow in different sections of the muscular wall. So, and they have different names. It's called intramural or subserosal or submucosal. And those are the ones that will grow actually inside of the cavity of the uterus. So like where a baby is supposed to grow.
Yeah.
The fibroids will grow. And if that happens, it can cause infertility because if you don't have enough room or area for your egg to implant, it gets fertilized, it won't grow the baby. So, unfortunately, if you have really severe, abdominal pain, cramps, bleeding, and you're struggling with infertility, it could all be because of fibroids. So, what are risk factors for fibroids? Risk factors, genetics, age, and ethnicity. So again, a lot of times it'll run in the family, mom has fibroids, you'll have fibroids. Again, age, usually we see women with fibroids. It kind of starts like, mid 30s, and then up from there because it takes a little time for the fibroids to grow. Right.
Yeah.
And then unfortunately, Black women are affected the most by fibroids. It just seems to be more prevalent in Black women versus other ethnicities. So,
Okay.
yes. And it, they impact your quality of life, with the bleeding and anemia and pain, discomfort, or whatever. And a big misconception is that, so one of the main reasons, and I've told Noodle this before, one of the main reasons why I've opened this practice is, a lot of times, interventional radiologists, we live in the hospital because we need big equipment, big, fancy, expensive equipment to do what we do. But with the advancement of technology, I have hospital level equipment, but it's smaller. And so I open my own office. So everything I do is done right here in the office. I have 2 surgical suites. And I have, hospital grade equipment. So, but we're in a beautiful outpatient center. You don't have to
Located in Garden City.
Located in Garden City, New York. So you don't have to go to the hospital to get your fibroids treated. You can come here. But one of the main reasons, there is many reasons, and I love to take care of women and men, but a big proponent of opening the office, why I wanted to open the office is because unfortunately, women, it's not even so much about not educating yourself, but when you go to see the doctor, you trust your doctor.
Yeah.
And you go by what your doctor says. And a lot of times women will go to the gynecologist and the gynecologist won't even tell them that a UFE exists, that they can get a fibroid embolization. The gynecologist just tells them surgery, surgery or surgery. So.
And why is that?
Because, older gynecologists may not believe that, a UFE is an adequate procedure, or some gynecologists don't even know it exists. I mean, nowadays, they do, it's better, but when I was first starting in my career, there were gynecologists that didn't know what a fibroid embolization is. And fibroid embolizations have been around for 40 plus years.
Yeah.
It's out there, it exists, it's just, if the doctors don't know about it and they're not telling the patients about it, not a lot of people know about it, And another thing is, Black women are mostly affected by fibroids, and with, healthcare disparity, not everybody has the same access to the same level of treatment and healthcare. So that is why, it's one of the big reasons why I opened the office, because it's kind of like my little soapbox, because I have seen too many women who have had hysterectomies and have had major complications because it's a major surgery. They will go and the GYN will tell them, oh, it's not a big deal. We'll do it laparoscopically, which, okay, that's good with cameras. But, they're taking out your uterus. It's a big deal. It's a big surgery.
And it does affect you in the long run.
Yeah, it does.
As a female.
It does. They'll say oh, you had your kids. You don't need your uterus anymore.
It's there for a reason.
Yeah, this is anecdotal. There are no medical research papers on this. This is anecdotal from my patients that I have seen who have had hysterectomies and then have come to me afterwards for other things. And then we get talking and they tell me, and I've had many women tell me oh, I just don't feel the same after the hysterectomy, or I don't enjoy sex as much as I used to after the hysterectomy, or, just things just don't feel right since the hysterectomy, so it is a big deal, and not to mention the other possible complications. And my whole thing is, and I tell my friends and my family and my patients this, always start with the least invasive procedure first. And that goes for anything in medicine. Start with the least invasive first. The more invasive procedure will always be there. Surgery will always be there.
Yeah.
Gynecologists will always take out your uterus. They'll always, the surgery option is always there. But that to me is always last resort. If there are minimally invasive, less invasive options that take care of what needs to be taken care of, then why not do that first?
Yeah, that's true.
And look, there are some patients who need surgery. If you have cancer,
you can't avoid it.
Right. If you have cancer of the uterus, your uterus needs to come out. This is not the procedure for you. And I'm not saying, you need to have that.
Everyone's case is different.
Exactly. But, for benign tumors or benign growths,
Mm-hmm.
you don't have to have your uterus removed. So, the surgical options are usually myomectomy, and this is a big difference between myomectomy and fibroid embolization. You know what I just realized?
What?
I have my little flippy book with pictures that I was going to bring so that I can show people exactly what an embolization is, but I forgot my flippy book.
Where is it?
That's why you'll have to come and have a consult with me so you can see the flippy book. So it's on my office. Don't worry about it. I have another one out there. But anyway, so the treatments for fibroid: myomectomy, hysterectomy, and then uterine fibroid embolization. My big difference between myomectomy and UFE, or uterine fibroid embolization, is that myomectomy is when they go in and basically they'll offer myomectomy mostly for women who don't have children yet or want to preserve, their uterus because they want to have more children. Because obviously, if you have a hysterectomy, your childbearing days are over because you don't have a uterus anymore. So they'll offer myomectomy to younger women. But the problem with myomectomy is they go in and they basically scrape the fibroids out.
Okay.
Problem with that is they can never ever get all of the fibroid tissue out. So those fibroids are growing back. It's a given. They're coming back. How quickly they come back depends on,
your body.
the patient, your body, but they're coming back. The difference with UFE is once I go in and kill those fibroids, they're never coming back. They're done. Now, theoretically,
10 day.
no.
I was like,
Once they're dead, they're
gone.
They're gone. What is it? Okay, that was silly. I should. Once they're dead, they're dead. But if you're a younger woman, let's say you're 38, 37, and I do if you don't go through menopause until you're 55, 57,
Okay.
can you grow new fibroids? Yes.
Yes.
You can theoretically grow new fibroids. But can we do the UFE again?
Yes.
Yes. Yes, we can. And I still think 2 UFEs is better than 1 hysterectomy.
Yeah. That's my opinion.
That's my opinion. You can have your own opinion. That's my opinion.
Yeah.
Yeah. So minimally invasive. So major comparison differences between hysterectomy and UFE. Myomectomy, not quite hysterectomy, but it's more in the hysterectomy category. But we're going to talk UFE versus hysterectomy. UFE, same day, minimally invasive procedure, faster recovery, not a major surgery. So UFE, minimally invasive. I do everything through a tiny little incision. So I usually go the way we used to do it. We would go through the groin, but nowadays the way I do it, and Noodle has seen this for herself and helped her recover patients. I go through a tiny little incision in your wrist right here. The incision is not even the size of my pinky nail. It's that tiny. It
looks like if I drew blood.
Yeah.
Basically. Just a little bit bigger, but the same size.
And then it's basically gone. So the way that I do it is I go in through here because I access your artery. And I take a catheter from your artery, from your wrist, all the way down to where your uterus is. And then your uterus has 2 main blood vessels. They're called the uterine arteries. Yeah. Go figure. And there's a right one and a left one. And we do turns. So first I do the right side, then I do the left side, or vice versa. It doesn't matter what order I do it in, but I always do both sides. And what I do is I take the catheter down and I put in these tiny little beads. Tiny, tiny. They're like grains of sand. And what that does is it cuts the blood supply off to the fibroids, but not your uterus. So the fibroids die because the blood supply to them stops and they die and they shrink and the symptoms go away, whatever, but you keep your uterus. So you keep your fertility, you keep your uterus, no major surgery.
And no more pain.
No more pain. Yeah. So UFE preserves your uterus. Obviously, hysterectomy does not. Recovery time, like I said, patients 5 to 7 days.
You're
And
ready
they're
to
back
go
to-
run
Yeah.
for a marathon.
I'm telling you. And she was before we were doing it through the wrist. So we used to go through the groin, which the difference is the nice thing going through the wrist is after the procedure, what it feels like is basically like a bad period. Like you get cramping, whatever. And so what do you want to do when you have cramps, right? You want to kind of curl up into a ball into the fetal position. So when we used to go through the groin,
You can't.
women couldn't do that because the size of the artery, you have to keep your legs straight, la 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 la. Now with the wrist, it's nice
curl
and
up as
easy.
much as
Right.
you want.
You can curl up into a ball, you can walk around, you can do whatever you want. It's wonderful. It's lovely. And also you're out of my office, you recover faster and you get to go home faster if we go through the wrist. But if you go through the groin, because there are other procedures that I still have to go through the groin with, I always tell patients, no heavy lifting, no strenuous exercise, for at least 7 days. This woman on day 5 was like on the treadmill running right, and I was just like, lady,
Yeah.
I love it. I love that you feel great, but no. So just give me 2 more days. Hysterectomy, that's 6 to 8 weeks of recovery. Yeah. It's abdominal surgery. Even if they do it laparoscopically with cameras, it's abdominal surgery. So it's 6 to 8 weeks. No hospital stay with a UFE. You come to my office, you come in the morning.
And you go back home.
Exactly. And you're back home that night and in your own bed, which is nice.
Yes. No one likes hospital beds.
No. I mean, hospitals, I could never understand when, like, patients would come in and want to stay in the hospital. I was like, you're not going to sleep. Like, hospitals are not made. I think people think they go to the hospital and they're like, ooh, it's going to be relaxing.
No, they wake you up, they bother you.
You get tortured all night long. Like, vitals checks, blood draws, whatever. It's not fun. So, anyway, you get to go home in your own bed. Obviously, with a hysterectomy. Although, look, nowadays, there are
good.
They'll do hysterectomy as an outpatient.
Oh.
You won't stay in the hospital overnight. Yeah.
Okay.
There are. So. And is this procedure covered by insurance? Yes, it is. It is covered by insurance. Yeah. So it's not an out-of-pocket thing. So, if you're dealing with fibroids, please come see me. Or if you're not going to see me, if you're somewhere else.
Come see me.
Yeah. No, seriously. If you're not going to come see me, if you live somewhere else in this country and you're watching this, but you want to know more, please DM me, message me. Is it called DM on TikTok? No, right?
Yeah, I think
Is it?
so.
Is it still called DM?
I think it is. Yeah. Direct message. Yes.
Direct message me. I will answer your questions for you. Just go see an interventional radiologist.
Yeah.
Okay. And don't go see. This is another soapbox. There are surgeons out there that think just because they're surgeons, they can do what I do. No. I'm specially trained. I went through many, many, many years and many, many years and many, many tests because, to do what I do. So go see an interventional radiologist. Okay. Not just anybody that says, oh, I can do a UFE. Go see an interventional. It's not me. Just go see a interventional radiologist. I just want you to know that hysterectomy and surgery is not your only choice. There are other choices out there. You have any questions? Ask your questions. I will answer them now. But yeah, that's it. UFE. Has anybody heard of UFE before tonight? Let me know.
I have.
You have.
Does that count? Not really, right?
Oh, have you heard of UFE before you came?
No.
To work with me?
No.
See, there you go.
You have to be more specific.
I learned my lesson. I will be more specific next time. All right. In our last few moments, let's talk about acne. Oh, it is Acne Awareness Month this month, the month of June. And I want everybody to know out there that it's not just teenagers that struggle with acne. You have very beautiful skin, Noodle. Did you have acne when you were a teenager?
Not really, believe it or not. I had it intermittent, but nothing like crazy.
Yeah. I didn't either. I was lucky. I made it through my teenage years, my pubescent years without acne. But there are many, many women and men out there who never had acne as a teenager. And now, as an adult, they develop it, and they'll have, bad active acne and they'll have scars. Or when you were younger, you had bad acne and you were left with scars. there are treatments that we can do, that I can do here in the office. Two of them are Morpheus 8, which is radiofrequency microneedling. And I always explain to patients that Morpheus 8 works from the inside out. Morpheus 8 and both Opus Plasma both help to rebuild collagen and remodel the skin, but they work in different ways. Morpheus 8 works from the inside out, and then Opus works from the outside in. So Opus is a great resurfacer. If you have active acne and just really kind of light scarring, or pigment leftover, sometimes you'll have pigment leftover from active acne.
Yeah.
Opus is a great choice for you. If you have deeper scars, Morpheus might be a better choice for you because that'll take care of deeper scars. A lot of patients, I do a combination of the two because, like I said, Morpheus is inside out, Opus is outside in. And if you have real deep scars, you might need a combination of the two treatments. And the major thing that I love about both machines is that they're not traditional lasers. And when I say that, I mean traditional lasers can't be used on darker skin tones or higher Fitzpatricks. And I think I said this last week also. Fitzpatrick. If you don't know what a Fitzpatrick scale out there is, it's just an easy way to categorize patient's skin based on how you react to the sun. Right?
Okay.
So you're fair. Mm-hmm. And I think SPF Awareness Day last week, I think Noodle mentioned you turn into a lobster in the sun.
Yes, I do. A happy lobster.
A happy lobster. So, but because you're not, usually a Fitzpatrick one, that's the lightest, fairest, they burn, even if they're almost like vampires. They burn. Even though you burn, you have darker hair and more Mediterranean, you would probably be a Fitzpatrick 2. More like a 2.
That's a good one.
Me, I'm not really a burner. I mean, I might burn a little bit in the beginning, but then afterwards I tan. So I'm probably more in but I'm very fair. So I'm probably more in the 2 to 3 range.
Okay.
So the fairer you are, the lower you are on the Fitzpatrick, the darker your skin tone, the higher. So darker skin tones, they can't have lasers done to them because lasers will target pigment in your skin. So that's why you can't use a traditional laser on Fitzpatrick, 4, 5, 6. And then also those skin tones, 4, 5, 6, they're more prone to, it's called post-inflammatory hyperpigmentation. So the higher Fitzpatricks, 1, 2, 3, are more prone to sunburn versus the lower Fitzpatricks, 1, 2, 3, are more prone to sunburn versus the higher Fitzpatricks, 4, 5, 6. The higher Fitzpatricks are more prone to post-inflammatory pigmentation. So they can't get traditional lasers. And that's why I love Morpheus 8 and Opus, because neither of them are traditional lasers. You can use them on every skin tone. So from Fitzpatrick 1 to Fitzpatrick 6, you can use Morpheus 8 and Opus. And that's pretty much the major reason why I got them, because I never want a patient to come in and say to me, "Can you help me with this?" and me say, "No, I'm sorry, I can't, because my machine
doesn't have it, or
I can't do it on you." I do have I have an IPO, which is good for sunspots and rosacea, light rosacea on the skin, and I can't use that on Fitzpatrick's, 5 or 6, which kind of upsets me, but I can't.
Yeah.
Some machines you just can't. But Morpheus 8 and Opus, you have to be careful. You are prone to hyperpigmentation. You hire Fitzpatricks, so you got to go to somebody who knows what they're doing. Okay? And that's why, don't get me started on med spas. You have to be careful. They're wonderful machines, and you can get fantastic results from them. But you have to be
make
careful.
sure it's someone that knows how to use it.
Because, I manipulate the machine. It's not like I just put a setting on and go to town. I need to
manage it.
Right. I have to manage it. I manage the energy. I manage the needle depth. I manage how many passes I do. I manage the time. Everything is managed, and that's based on my training and my experience. Mm-hmm. So, I think that's it. Is there anything else? Oh, and then afterwards, after hi everybody. I'm sorry. I haven't been saying hi to everyone. Hello everyone. Thank you so much for joining.
Today. It's so nice.
Wonderful. It's so nice to see everyone. Jip and Kisso and Nico and Jose and
Natalie.
Natalie? Is that Natalie? Oh yeah, Natalie. So hello. After we take care of your skin, I also have one of our topics, maybe next week or the week after, I don't know, we'll see, is going to be the different skincare, over the counter versus organic versus medical grade, and why medical grade is the best. But, if we do acne treatments on you, I have acne, what am I trying to say, Noodle? Focus. Skincare that's focused for acne. So to maintain your results and improve your skin even after we do the treatments. Okay. So yeah.
That would be an interesting topic.
So all right, I guess it's like 7:02, right? We can be wrapping up our talk. Is there anybody that has any questions? Any last minute Q&A? If you want to ask me about uterine fibroids, if you want to ask me about acne treatments, Morpheus, Opus,
your spotlight is now.
Yes, it's now or never. Although, like I said, DM me, message me. I'll try and answer your questions. But look, if you want to come in for a consult,
you're more than welcome to.
You call Noodle up.
And she will answer.
And she will fit you in, and we can talk. There's no pressure to buy anything. We can talk. We can discuss. You can tell me what your concerns are, and we can figure a plan out for you. Skincare, treatments, whatever. Yeah, that's pretty much it. And, we also, if you are in the area and want to come see and you say like, oh, goodness, unfortunately, the cosmetic stuff is not covered by insurance. Uterine fibroid embolization is covered by insurance.
Yes.
But unfortunately, the cosmetic stuff is not covered by insurance. But we do have a firm here. So
which is a payment plan.
Right.
And it will.
So we do have financing options. So, and because it's Acne Awareness Month, guess what, Needle?
Oh, I'm excited to hear this. What?
10% discount all month on Morpheus and Opus packages. You come in and say, I want my TikTok 10%.
Make sure you fight for it, too.
Because Noodle, she's real bad. She's not much. You come in and say, I want my TikTok 10%, and I will give you 10% off of Morpheus and Opus packages for acne.
Enjoy it.
Yeah. All right. I think that's it. So let's see. I hope that I educated you on uterine fibroid embolization. I hope that educated you on some options for acne. So let's see. Noodle, what's up? What should we talk about next week? You want to pick the topic, or you want me to pick the topic?
I picked the topic last time.
I know.
What's your time?
I know. I don't know. What topic do you want to talk about? Do you just want to do we want to do medical? Do we want to do skincare?
Well, I do like that we do like medical and then one.
And one medical. Okay. How about we could talk about laser lipo?
Okay.
We are having a laser lipo flash sale that is still happening. Again, link in bio. You can check it out. DM me. I'll talk to you. So, okay, we can do laser lipo, and then we have to come up with a medical.
Do you want to do GAEs?
Okay, that's a good idea.
Yeah.
Okay, we're going to talk about GAEs. GAEs are a treatment for osteoarthritis because it used to be shots and then surgery. And now we have GAE, which is in the middle. Helps with pain. So I think that's it. All right. Noodle, do you have anything to add before we sign off?
No, I do not. You answered all my questions today.
Excellent. I hope I answered all of your questions. Don't forget, replay of the TikTok Live is on Thursdays at 6:30 p.m. I don't know exactly what that means, but like, am I supposed to just like replay it, or like do I post it to like the TikTok? I'm learning, guys. But anyway, replay 6:30 is tomorrow, and you can also hear this on Spotify as a podcast. Ooh.
You get a whole bunch of Dr. S.
We have to get more Noodle, though. You've been half off the screen the entire time. So anyway. All right. Cats and kittens. Thank you. Thank you for joining us. Thank you, everyone. We'll see you
next Wednesday.
Next Wednesday, 6:30 p.m. Come ready with your questions. Laser lipo suction with fat transfer. And GAE, which stands for genicular artery embolization, which is to treat osteoarthritis of the knees.
That's a really good option.
All right, everybody. Thank you for joining. We really appreciate you being here. And from Ior Interventional Vascular Care, Noodle.
Noodles. I got a toodles.
Bye.
Bye. Oh, that's great.